Who's going to be my bar?
What's it for?
Come on.
What's it for?
I remind you. Come on.
I mean, jeans, is that
No, I'm just, your jeans is fine. No, I'm going to be demonstrating on you, that's fine. It's just through clothing.
They are Velcro, I can just put them on.
I won't hurt you much.
How do you want me?
Oh, yeah, that'll be fun. Good stuff. So a lot of you have been using things like PNF, NET to do your stretches, right? How many of you are soft tissue specialists or have massage background? Wow, fantastic. How many are you familiar with soft tissue release? A couple of you. All right, right. So, like Brandon said in his talk, this transverse soft tissue technique came out of the need to create something different out of a difficult situation. If any of you know, well, some of you do know longitudinal STR, you're working with the origin and insertion of a muscle, and sometimes it just doesn't work on a table, or it doesn't work on the floor, it isn't in the gym, it isn't viable for you. So out of creative play, I came up with something called transverse, which is working across the muscle. So I'm going to take you through something that you can do with your clients on the floor. You know, you're in the gym, you see something happen, you're going, okay, that muscle is not engaging. The PNF stretch is quite often too strong, and the MET is actually not targeting the area that is stuck. So the purpose of transverse is that it accesses tissue in such a way that it separates the layers. So in other words, you're giving space to the different layers in the tissue. So if you've got a very tight hamstring, for instance, and you're stretching the hell out of it and it's just not moving, it's probably because it's not length that needs to change, but it is the structure within it. The fascial structure within it is probably all locked in together. So you need something that's going to separate it and take it apart so it can get hydrated and thereby create nutrients inside it and also to create movement. So sometimes, you know, you've got a situation where you're seeing someone squat, you're seeing that they're not engaging the right muscles, and you think, if I could just tweak something really quick here so I can get something proprioceptively engaged, what could I do? And this is what the transverse does. You can work at any time, and you don't have to prepare with effort or petrissage. You just simply get in, you do your movement a few times, you get out, and you say, okay, that's knocked out a few things, that's engaging this, that's released that, here I go. And so that's what I'm looking at, to be able to give you something tangible that you can go away with and play. Okay? So I'm going to demonstrate to you just one example. And now this is where you're going to have to come up. You are going to have to come in and look at what I'm doing, because you won't have the concept sitting back there. It doesn't happen. So come on back now. Okay, what I'm going to work with is hamstring. So I'm just going to concentrate on the lower half. The upper half gets a little bit more complicated, but let's just do it the lower. Because the idea with normal soft tissue release, you're taking in, you're locking, you're taking up your slack, and then you're doing movement. And that quite often is too specific. You use your front thumb, you use your fist, whatever. It's quite often just too invasive. So this is all about creating a flatter surface which engages more tissue. You sink in, you get your depth first, you take up your slack, and then you create a movement. Now what effectively, you are tight.
Well, thank you.
I won't take that to the... So think of it as, okay, so this is our fiber rate. I'm going to say this is a length of fiber. And what we're creating is that we're creating what I call is a C curve. So you're creating that into the tissue. And you're bringing it to its end range, basically, which means taking up the slack. So you're taking that to the end range, and thereby your motion is going to go against that point. So if you're not feeling the stretch, you've actually not got it, right? So you've got to feel that it engages. You don't go far. If you're going too far, then you haven't got the depth, you haven't got the contact. So it is about getting into the depth, taking up the slack, and then creating your movement. Right? This is not about speed. It's not fast. It is about feeling. It's about palpation. This is something that requires you to come out of the headspace and let the hands be free. Yes? They're going to be the all-seeing, the all-knowing, because they will tell you more than what your head will tell you. They see better. Okay? So when you're in, so in this instance, I'm just going to take up the slack. I'm softening this up because this is actually very tight. So I'm in, taking depth. Notice where my body is on this, but I'm going to show you how to adapt it to the floor so that you can use this within your training sessions. You don't have to haul out a massage table to get them into this position. All right? But for demonstration, this is where we're going to go. So depth, take up your depth, take up your slack, create your movement. And so that's what I'm going to get you to start with somebody. You're going to make a new friend, hopefully. Choose somebody you actually don't know. And then we're going to get you, I hope you're not too precious about being on the ground. I'm sure most of you have been on the ground many times in your training sessions. So find yourself a space, and I'm going to talk you through it. Okay? So somebody, somebody turn on space up here. We're cool. All right. So you've got to find yourself a good position where you're going to be working at. If you've got problems with knees, that's okay. You can still sit there and you can be on. Find yourself somewhere comfortable. Okay, we're working together. Okay. All right. So soften up your legs. Soften up your muscle. You don't all have to. I'll show you another method. I'll show you another method without having to do this, but let's get this principle down first. Okay, so you're going to sink. You must remain relaxed. In other words, you can't be going, I'm going to sink. There's a different feel to that, isn't there? Versus, I'm just going to rest into this. And then because gravity is taking you there, you are naturally going to sink to the depth that muscle allows you to go. So you don't have to force yourself. So you're going to sink, you're going to take up your slack, you're going to find that bind in your tissue. So you're in, take up slack, and then you're going to move. And you move it to that point that you feel that sort of stretch and resistance. You do not have to move it beyond that. Yes, try it out. Get some feedback from the spine. Feel it. So just keep going. And when it starts, there. That's what you want. Okay, so you can sit. Just sit down. Good question. All right, I'm having a couple of really good questions here. One of them is, basically, what direction do you move in? So if you are sinking in, taking the tissue away from you, you are counter-forcing it. Think of it like being in the pub, pouring the beer, right? You put glass down there, and you pull this baby towards yourself, okay? Right? So it's in, away from you, and you take the leg pulled towards you.
How much do you pull the leg away?
Okay, that's a great question. When you feel the stretch. So, if you've got the engagement, as I was saying before, if you've got enough depth in taking up your slack, it won't be much. Yes, sometimes it's like that. It's like you're just thinking the movement rather than actually doing it because it's so precise. So think about the moment you feel it's giving you a stretch, you don't have to be on that because that's what you've done. You've finished the shear. Okay? Try it out.